Hello everyone, this is Meldita and I'm back here at my YouTube channel, MELDITA'S Info Corner. My Facebook is johnregacho@yahoo.ca. Okay, as I promised before, this is the last video of my kidney transplant. And the topic is about cytotoxic safety precautions after hospital discharge. So the patient and the caregiver will follow these precautions. Okay, before anything else, I'll talk a little bit of these medications that need cytotoxic safety precautions. Okay, so the following medications that need cytotoxic safety precautions. Example here, tacrolimus, sirolimus, mycophenolate, cyclosporine, and azathioprine. Okay, you notice that prednisone is not listed here because prednisone does not need cytotoxic safety precautions. Okay, so what is the significance of these medications? For the patients, these medications are beneficial for the treatment. But for the caregivers, these medications are harmful to their healthy bodies or healthy cells if precautions are not followed or if the caregivers are not careful. So, how are anti-rejection medications processed in the transplant patient's body? Okay, the anti-rejection medications are swallowed by the patient. The medications remain in the body from 1 to 7 days. Mycophenolate will stay up to 7 days in the body. Tacrolimus will stay in the body up to 2 days. And for your information, prednisone stays in the body for about a day. But I just mentioned this prednisone for information. So our center here of the topic is mycophenolate and tacrolimus. So these medications are gradually removed in the urine and stool or feces. For mycophenolate, it is excreted in the urine 90%. And for the tacrolimus, it is excreted in the feces 80 to 95%. But there's a small amount of tacrolimus in the urine, very small amount of tacrolimus in the urine. But there are small amounts of this medication present in other body fluids. We have the sweat, the saliva, the vomitus, the semen, vaginal fluids, the breast milk, and the blood. Okay. Now, let's get back to the cytotoxic precautions here. But there are some patients that are very independent. They do everything by themselves. But there are other patients that need caregivers to help them out at home. Okay, these caregivers are healthy individuals helping the patient. And these caregivers are the following. The caregivers could be the spouse, could be adult children, or the live-in partner. So these are the situations where they practice here these safety precautions. Number one, preparing the medications. If the patient will prepare his own medications, the patient does not need to wear gloves. But if the caregiver will prepare the medications of the patient, the caregiver has to wear gloves. And then, after preparation of the medications, discard the used gloves to the garbage and then wash your hands after. The caregiver will use soap and water. Okay, number two, regular contact, hugging and kissing. Okay, light kiss. I'm not talking about Spider-Man kiss or lizard kiss, light kiss. Okay, in this case, there's no protection involved. Okay, sexual contact. For the sexual contact, is it the regular mode, oral mode, or the anal mode? So, in this case, if the patient is male, the patient has to use condom. If the male is not a patient, the male still has to use condom. Used condom will be discarded in the garbage, and then the male will wash his hands after. Then he uses soap in water. Use of the toilet. After the patient urinates or moved, after the patient had urinated or moved his bowel, okay, the patient will put the lid down right here with a cover and flush the toilet twice and wash the hands after. The patient will use soap and water. Okay. Flushing the toilet twice with the lid down will prevent aerosol formation. Okay, it's contained. What if the caregiver will do this job? So the caregiver will put the lid with the cover down, flush the toilet twice, okay, and wash the hands after. she has to use the soap and water. So we prevent the formation of the aerosols because the aerosols contain part or fragments of this medication, and we don't want the caregiver to inhale this aerosol that has medications in them. Okay, that's for protection. We don't want invasion of the mucous membrane of the airway. Okay, so aerosol has contents of these medications. Next, use of dishes and cutlery. There's no need to wash separately. Cleaning up of body fluids. Let's say the body fluids are found on the floor. So the caregiver has to wear gloves, uses disposable wipes and discard in the garbage, followed by clean wipes with soap and water and discard in the garbage including the used gloves, and then wash the hands after. We'll use soap and water. Okay, how about cleaning up of soiled items with body fluids? If the soiled items are disposable, then that will be an easy job. So the caregiver has to wear gloves, scoop all these disposable soiled items, and dispose them in the garbage, including the gloves, okay? And then wash the hands after, and the caregiver will use soap and water. How about cleaning up of clothing and beddings with body fluids? The caregiver will have to wear gloves, will separate these contaminated clothing and beddings with body fluids in the laundry bag, wash them separately, dispose the used gloves in the garbage, and wash the hands after. Caregiver has to use soap and water. Okay? So, we have here protective barriers. We have the gloves to protect the skin, especially if there's a break in the skin. Use of hand washing, using soap and running water. Use of condom, okay? Be sure that this condom is intact, and we don't want, invasion of our mucous membrane, the drugs in the fluids, okay? Be sure that's intact, and the partner has to, has to observe good oral hygiene to protect the mucous membrane of the mucosa or the oral mucosa, okay? And putting the lid down to prevent aerosol formation, to prevent inhalation of this medication mixed in those aerosols for protection of the airway mucous membrane. Okay, how about if we have an unused and expired medications? In this case, the patient will return these medications to his pharmacy. Do not throw these medications in the garbage, and do not flush these medications in the toilet. Okay, that's about it. And this will be followed by Tagalog version. And as I said, this is the last video, and soon we'll be proceeding to the cardiac topics. Okay, thank you so much. Again, this is Meldita.